Hi, welcome to, I think we've got one participant currently. We might have more. I can't really see everyone. No, welcome to this short webinar for the Health Economics and Health Technology Assessment Program. We've got a couple of slides just to kind of orientate ourselves, but we really wanted to make this more of a Q&A session to give participants the opportunity to ask specific questions they might have about the program. So we can probably start with introducing ourselves. Eleanor, would you like to make a start?
Yeah, hi. Apologies for being a bit late there. Um, so I'm Eleanor Grieve and I'm a senior lecturer here in Health Economics and Health Technology Assessment, HETA. I've been with Glasgow University for about 15 years now. I co-lead the MSc and I also lead the global HTA research theme as well. So my interest in particular is in research in lower and middle income countries, but I also do a lot of work in the UK and in Scotland around different interventions as well. So yeah, happy
Thank
to
you.
answer questions at any point. Yeah.
Thanks, Eleanor. Margaret, do you want to?
Hi, yeah, I'm Margaret Ashton and I'm the postgraduate administrator for the Health Economics and Health Technology Assessment Programmes.
So my name is Claudia Goyer. I'm senior lecturer in health economics and health technology assessment as well. And as Eleanor said, I co-lead the MSc together with Eleanor. And so maybe just a couple of slides to kind of tell you a little bit about the program. So health economics, health technology assessment, we basically explore health economics statistics, type of evidence modeling, and patient-reported outcomes to guide principles of health technology assessment and to help with decision making in health technology assessment. During the program, very much focused on appraising evidence and understanding consequences of technology to prioritize its use. And it's a very multidisciplinary program, as you will see from the slides that follow. So some of the learning outcomes I've just noted here. We kind of look at, also by the end of the course, students will be able to analyze policy, principles, and methods and analytical techniques appropriate for health economics and HTA, and also evaluate how these policy contexts vary between international regions and countries. And Eleanor just mentioned, so she leads our global HTA theme, and there's an associated module as well, which very much focuses on kind of the international differences differences in evaluating evidence and carrying out HTA. Students will also learn to use kind of statistical methods, evidence synthesis, decision analytic modeling, economic evaluation, and also patient-reported outcomes to underpin the principles of health technology assessment and critically assess research methodologies used for informing priorities and decision-making. Students very often ask about the career opportunities after an MSc in health economics and health technology assessment. So it's really kind of a really wide field, including or kind of depending on your kind of area of interest. So students will be kind of equipped with kind of qualitative and quantitative research skills, and these would lend themselves ideally for jobs in academia, so higher education, pharmaceutical industry, um, government information services, statistical agencies, or regulators. And so health technology assessment and health economics are growing in importance because there's scarcity in terms of budget, and it's becoming more and more important to make decisions on how to allocate those scarce resources. And we do find there's an increasing demand for employees with those relevant skills in health economics and health technology assessment. Eleanor, do you want to do the second part?
Sure. So we have we structured the program in that we have core modules and optional modules. So students can either undertake a postgraduate certificate, a postgraduate diploma, or the full master's. So I'll try and explain briefly what the different elements are. So the postgraduate certificate you would undertake our 3 core courses only, and so everyone who's doing, whether it's the certificate, the diploma, or the master's, would have to undertake these core courses. And at the moment, we've just revised our core courses. So HTA, Health Technology Assessment Policy and Principles, so it gives you a good introduction to what HTA is about. Health economics for HTA. So again, oh, thanks. Yes. So health economics being a key methodology of HTA. And so there's a 10-week module dedicated to an introduction to health economics. And then it was until this year statistical medical statistics for HTA. We've now replaced that with a sort of more wider research methods for health economics and HTA. So that is really taking more of a deeper dive into health economics, a bit more about modeling, a bit around real world data, a bit more about evidence synthesis. So it's kind of a bit of a bridge between the more introductory courses on the different methods that we use, and a bit of a bridge between if you wanted to then explore more on, for example, real world data and using that in HTA, and Claudia takes that course. This research methods would be that sort of bridge between the introduction of what we're talking about, and then following that up with optional modules that go into much more detail on different areas specifically. So that is our 3 core courses, which everyone would have to do. And if you were only doing the 3 core courses, you would get a certificate after that. If you were to do the diploma and the master's, you would then take 3 optional courses, and they're a mix of 10-week courses and 5-week courses. So all the core courses are 10 weeks in length. The optional, we do have a mix of some that are 5-week and some that are 10-week courses, but you would have to take 60 credits. So if you took a 5-week course, you would have to take another 5-week course to make it up to the full allowance of credits that you need. So these are our various optional modules. So Claudia mentioned HTA in a global context, which I take. So it looks at about the different methods, different practices of HTA in contexts around the world, high income and low income countries. Real world data, so it's a bit more about how we use linked data sources, and Claudia takes this. So this is gaining more and more traction in HTA these days as sort of maybe moving away from randomized controlled trials to some degree and utilizing much more the routine data that's captured. Decision analytic modeling and early HTA. So decision modeling is a key skill to use in HTA, and we put this in the context of early HTA where HTA can be done at an early stage of an intervention. So it's not about doing an evaluation after the intervention's been rolled out. We can use early HTA to inform product design of technologies. It's usually around devices and med tech. So that's another option. Choice experiments. So discrete choice experiments is a way of valuing willingness to pay, a way of putting a value on technology, where they're often or understanding people's preferences around a technology. And again, a lot of it is used to maybe help design a technology. I've personally used this around AI digital technologies. So maybe putting a value and understanding people's preferences for different attributes around these sort of more novel technologies. Survival analysis. So again, people, if you're more interested in the sort of statistical side of things, looking at survival outcomes and using data to interrogate outcomes, and it doesn't need to just be survival at the end, but looking at outcomes over time. Qualitative research. So we understand that a lot of our modules are quantitative in nature, but qualitative methods absolutely have a place in HTA and very interlinked. And so and a lot of our work is embedded in using qualitative methods up front in many of our appraisals that we undertake. So there's the option to think about stakeholder preferences and interviews and focus groups. And so that's another module, maximizing the value of clinical trial data. So this is quite an advanced course where we look at economic evaluations alongside clinical trials. Am I right in still saying that this is going to be run slightly differently in that it's run over a period, or I'm looking at Claudia. This
I think
was
we're changing it this year. I think
Yeah.
it's going to be run over 10 weeks online and asynchronous, but with kind of regular Q&A sessions. So each online week then has a Q&A session with the respective faculty lead for that week. So.
Thanks. Yeah, I should have been up in that. We run this with quite a few external contributors. So, we've got a lot of really well-renowned health economists in the field that contribute to this course. So it's run slightly differently, but it sounds like it's more accessible for our online students now. And statistical methods, as I say, that used to be our core course on stats, but it's absolutely there to be taken as an optional module now on, as it says, statistical analysis for HTA. So if you were then going on to do the master's, what distinguishes the diploma from the master's is undertaking a research project or a dissertation. and we usually allow around 6 months, can be shorter or longer, to undertake a project. It is much more of a win-win situation when students are able to um, provide or indicate what their interests are, if it aligns with their work. A lot of our students are working full time as they're studying. And so if we can work together with a methodology or a topic, a thematic topic that's of interest and of use to a student's line of work, then that it works both ways for us and for the student. So it can be, there's some titles on the screen there around sort of evaluating long-term cost effectiveness of different interventions, systematic review, developing a framework for multi-criteria decision analysis. So some might be sort of more case study orientated around different methods. So it can really be around any HTA methodology and around any theme that is of interest. And there's often 2 supervisors to a student, and we support you and take you through that dissertation project, which should hopefully be an enjoyable experience if it's a topic, you know, that you're interested in, and you get to learn much more in depth and apply a method to your own area of interest. So your first priority as a student is obviously passing the dissertation, but we often publish as well with students afterwards, where we've got where we think that the dissertation is of high, you know, quality, and if there's an avenue to publish, then you know, we would continue to work with students after they've graduated to help them do that. And then the online environment. So how we teach. So we do we have our teaching platform, which is Moodle, and we make sure that the materials are all there up front for students to access in their own time. So it's not that we are setting times during the day to do lectures. Everything is recorded and all the materials are made available so that they are accessible at any point. We do try and do some live Q&A sessions or summary sessions, but again, they're always recorded. So don't want students ever to feel that they're missing out if they can't make anything live. But on the other hand, it's nice to have that interaction where we do have opportunities for students to engage with their peers and with us to ask questions. There's a weekly discussion forum. So each week there might be a different lead. So in a 10-week module, you might have 5 or 6 different lecturers, and there'll be a weekly discussion forum where you can interact with that lecturer and your peers on set discussion topics. Interactive video and audio. So again, it's our platform is quite different modes of learning. We can put up videos and short audios to accompany the materials. As a student, you would have access to all our journals or all our online. You'd have full access to the library, so electronic books, etc. So everything as an online student would be available online. We don't recommend books that you can only sort of have to buy. We recommend, we have reading lists that are online, so everything should be accessible, and you would get free access to that through your student ID. So the learning platform that we use, you can use that on your phone or tablet as well. It doesn't have to be on the computer, so you can look at it and to whatever is the most convenient way. We invite students to attend our some various seminars and meetings. We have a work in progress meeting every 2 weeks for staff, and where we informally share our own progress amongst ourselves, our own research, And so students are very welcome to join that. It's a hybrid meeting, so those of us that are in the office can attend in person, and others will attend online. So we make that available for students. Also, any external seminars that the university has, we have guest seminars that particularly around the health economics topics. We have Maurice Bloch, which is an external seminar series, and students would all get you would have full access to these different types of external seminars as well. And then we do offer, if students wish to present their project to the team, it's not obligatory, but it's good practice and a way of honing your presentation skills and getting feedback on your dissertation before you're writing it up. So we try and involve students as much as we can in our HETA team. Yeah, and so that's it. So yeah, so if there's any questions, I'm aware there's not many people online, but feel free, Benedict, to ask us any questions if you're online, or otherwise we are emailable and contactable at any time, and very happy to answer any questions that you have, either on the content or the more practical side. So aware that Margaret is here. I don't know, Margaret, do you want to say anything on the practicalities? Margaret has keeps us right on all the key things that make us
I mean,
operate.
some of the general questions that we sometimes get are about students who are doing, you know, can you move from a PG cert to PG dip to an MSc, and how easy is that? And it's very straightforward. Some students start off with a PG cert or PG dip, and that's all they ever plan to do. Some students will start off with a PG cert and then move to a dip, and finally the MSc, and that is easy to do if you achieve the required GPA to progress to the full MSc. There's a lesser GPA required for the PG cert and the PG dip, and a slightly higher. So as long as GPA to progress to the research project and MSc, so as long as you achieve that required GPA, there is absolutely no issue about progressing to the MSc. There is a study period. So if you started off with the PG cert, but your long-term goal was the MSc, you have 6 years to do that in, which is quite a decent study period. Most students, I would say, who start off with MSc will complete in 3 years. So they'll do their top courses in 2 years in their project in their final year. But it's very flexible, and a lot of students will have some sort of break during their study period. It might just be one semester where they don't take a course. Some students will have a year, just depending on circumstances. So as long as, if you're doing the full MSc, as long as you complete that within 6 years, then it's fine.
That's great to know. That's the only question I really had, because I'm currently in discussions with my manager if my work is going to pay for the course or not, and then to not put too much pressure on them, I just wanted to get them to pay for the certificate at first, and then see if it made sense with my development plan to go for the diploma.
That's probably why a lot of people will start with the PG cert. It's around funding, and then once they've got the funding for that, then hopefully they can get the funding to move to the next stage. So, and it's very easy. You don't have to reapply or anything like that. We just change your program to whatever you're changing to. There's no issue with it at all. As I say, just as long as your GPA is at the level that is required.
Great.
I mean, there's another kind of general question is people ask, how accessible is help during your studies? I mean, I would say, I'm sure Claudia and Eleanor will agree, there's lots of help when you're doing your courses. You have your course leads But in general, at the university, there's lots of student support. Students will have an academic advisor. We have a student support officer. There's lots of wellbeing services at the university, so there is a huge amount of support available. And what we always say to students at the start of their studies is communication is key. You know, if you're struggling in any way, there is help available, and if you highlight those issues to us, we will be able to help you. And I think quite often students are surprised, how when they actually come forward and think, oh, I didn't think there would be help. There's help available for everything. And it's just, as I say, that's just the communicating with us that helps available. It might be, your circumstances might change once you've started studying. And we absolutely understand that, especially students studying online, because most students studying online will be working full time, and we understand that. And a lot of them will have families as well, so they've got a lot of calls in their time, and sometimes things happen, and that's why it's fairly flexible. And I would say more than 50% of students during their study period will have some sort of break, and that might be because financial reasons. They might need a little longer to put the money together to pay for the next course. It's quite often life circumstances, something crops up, and it's more important than their studies, and we quite understand that.
I think I saw something on the webpage that you of course hope to have this course offered, but that there might be changes. Is that correct? Now also that it's only me who's here for the introduction, I was just wondering how many people actually have to sign up for the course to actually be going forward.
So I don't think there's currently no minimum number. So we do have 3 intakes. So we have the main intake is usually in September, and then we've got students starting in January and in April. So these are the 3 options where you can kind of enter. So that's when each of those core courses run for the first time. I would generally recommend if you can do it at September start, because that's kind of, in terms of core courses, they tend to build on each other a bit better than kind of starting in April with the research methods course. And so currently over the 3 intakes, we have about, I would say, 20 students, perhaps.
Probably between sort of 15 and 20. Probably roughly about 15 students over those 3 intakes a year. And that's been a kind of steady number for us over the years. It's about 15 in total. So at the moment, I think we've probably got in total about 35 students. Across all the different years, and some doing PG Cert. The majority of them are doing the full MSc. We probably get more doing a PG Cert than we do doing a PG Dip. There's a couple, but it tends to be the main one is the MSc, and then the next one is the PG Cert, and I think we've got about 2 doing the PG Dip. So I think it's compared to other programs, it's a small program, but it's quite nice because you get to know people, and even though it's online, you can kind of get to know the students quite well over the number of years. It's always because it's an online program, and probably like in real life, some students are kind of very engaged and we have lots of contact with them. Other students just want to get on with the course content and aren't as engaged, but it doesn't mean they're not kind of achieving what they want to achieve. It's just mix of people and how people approach kind of online study.
Yeah, definitely.
I'd say that's definitely true. I mean, we do our best to promote engagement amongst the students, but you'll always have some students that just want to study and are not interested in anything else, and that's fine. That's why it's flexible. It's set up that if that's what you want to do, you can do that. But if you want to, more of an engagement with the other students, then that's available as well.
Yeah, good to know. I was doing my last master's during COVID, so I'm used to the
So
online stuff.
it was online whether you wanted it to be online or not.
Yeah,
And
definitely.
another thing that, students sometimes ask is, if you're a local student or, how you're not that far from Glasgow, they say, oh, do we get a student ID card? You absolutely get a student ID card. And if you were local, you could come in and use all of the university facilities. Or if you were visiting Glasgow, you have, full access to the university facilities, just like an on-campus student would. And like I have another online program, and there's quite a lot of local students, and I know that they take advantage of the facilities at the university. So, and even if we're absolutely encouraged if MD wants to visit, how they're most welcome to come, have a look round the school and, visit the university. And the other thing that we often ask is, do you get to graduate in person? And the answer to that is yes.
Okay, I have never tried that before, so that's
Yes. So
nice.
the only difference between your experience is how you study. Everything else will be exactly the same as an on-campus student. So you would get to attend a graduation ceremony if you wanted to attend a graduation ceremony. That is available to the online students just the same as it is to on-campus students.
And I have been to Glasgow before, and it's a very nice city, so then I have an excuse to come.
Where are you based at the moment?
Copenhagen.
Oh, Copenhagen.
Okay. That's a very good idea as well, I hear. So
yeah, it is. Can't complain.
I was just going to add as well that some of our modules are shared with other masters. So health economics gets a lot of our public health students as well.
Yeah.
So whilst we might be a smaller masters cohort, some of the courses can get a lot busier because there's public health students, global health students, and again, it's quite nice having that mix of backgrounds and MSCs. So some of the modules, there can be a lot more students because they're sharing, or some of them are doing a health economics specialism in their masters in public health. So and then other modules can be quite small and intimate, and then others are much bigger. So it's a bit variable, but yeah.
Would you say in general that the course content is quite practical in nature, and that, because I was hoping to find something that's very aligned with the work that I'm currently doing at my job here in the pharmaceutical industry, so that it's hopefully not too theoretical, but also gives you hands-on experience.
yeah, so we're all active researchers, so most of the examples or case studies and yeah, most of our teaching is based on research and case studies, and there's usually so you get your weekly lecture delivered online, but there's also a practical element each week where you get to kind of try out hands-on coding and all. Some people like it, some people don't. Some are kind of a bit more kind of stats heavy, a bit of coding, some of the modules. But each week does come with a practical exercise that we kind of ask students to do and to kind of share their results and opinion and thinking around it. Sometimes it's just kind of asking a question and what your opinion is and what your thinking would be. But yeah, so it depends very much on the content.
Yeah. Okay.
If you visit, I don't know if you have visited our website yet, but if you do, you'll see there's a section called Program Structure. So if you click on any of the course names, it will give you like the aims of the course, a short description, the intended learning outcomes, and the assessment methods for that course. So it just gives you an idea of what each course is
entails.
Yeah.
Yeah. Okay, great. Thank you so much.
And as I say, there's an email address on the website. If you've got any other questions at all, please just drop us an email.
Yeah, I think I also have to email because I'm a bit unsure about the language requirements. specifically for Denmark. I have they call it a gymnasium A-levels English exam, but that's a long time ago, so I guess I
Yeah,
might
I
need
mean, I think
referral.
you probably find that an English language test is required. It's
Yeah.
because but all of that information is on the website, what they accept. So
Yeah.
just have a look at it. Any questions, just drop us an email.
I will.
Yeah.
Good.
I think it's an IELTS test that is required unless a previous degree was taught in English. So
Yes,
if you've done
it's got to be within.
whether I
Sure.
think it doesn't.
But there are some other options, and you can go in and put your country, and it will tell you, how what the requirements are, and what English tests are available. They will accept.
Yeah, I did that already, and it said that if I had this A-levels done in the last 7 years, then that would be accepted. But it's a
If
bit
you're
more than 7
just
years
drop me
ago.
an email, because there's like an inquiry inbox, how like to admissions,
Yeah, okay.
and they're the ones that will be able to tell you for certain if that's acceptable. So
Great.
I mean, you can either drop me an email and I'll send you that link to the inquiry, or if you were planning to submit an application anytime soon, if they had any issues with that, they would come back and tell you. So
Okay.
it's either you can preempt it by making that inquiry before an application, or it depends when you're making an application. If you're waiting a little bit longer, you don't want to then discover that you have to do something and then it's all a bit of a rush. So it might be better to preempt that and find out in advance if what you've got is acceptable.
Yeah, good advice.
Okay. So I think that's it. Okay, well, thank you for coming.
Very nice
thank you
meeting
so
you.
much.
And
You
just
too.
Margaret said, just drop us an email if there's any additional questions. But yeah, nice meeting you.
Yeah, and
You
I guess
too.
the
Have a
same
nice
goes for students that are watching this on demand, that again, to contact us if there's anything. I know that this goes out to students afterwards as well. So feel free to contact any of the three of us. So yeah, but thanks, Benedict, for turning up in
Thank
person.
you.
Thank you.
Bye.
Bye.